For more on the concerning spread of the Delta variant and the possibility of booster shots, let's bring in the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Dr. Fauci, always good to have you on the show. Thank you so much for your time.
Thank you for having me.
As case numbers continue to spike, you've warned of a major surge that could get even worse, and the CDC's latest forecast for what this pandemic might look like by Labor Day really kind of disconcerting, if not downright frightening. How far are we from the peak of the surge, would you say?
You know, it is very difficult to really accurately determine that. What we do know, and that's just the reason why we keep just trying to drill it down and get people to appreciate that we can put an end to this and we could stop this. We have 93 million people who are eligible to be vaccinated who are not vaccinated. Right now, the easiest way to turn this thing around is to get as many people vaccinated as you possibly can and to do it as quickly as you possibly can.
And when we're talking about the Delta variant in particular, do you see this wave continuing throughout the fall? I was talking to a friend of mine the other day and she said, well, look what happened in the UK. Do you think that we could see a similar drop off at some point here as we've seen with other countries?
Yeah, we can see a drop off, but you want the drop off to be due to the fact that you're vaccinating people. I mean, you will see a drop off if you get so many people infected that you wind up having a combination of vaccinated people and infected people, that you have a degree of protection that you hope will last. But wouldn't you rather get the drop off due to the fact that you're preventing infections rather than you've gotten so many people infected? That's the reason why vaccinations are so important.
But somebody like yourself who got the vaccine right as soon as anybody could get it, as early as possible, you're an elder American. Are you yourself considering taking a booster or getting another shot at this time?
What will happen is that we will look at the data, and we're doing that in real time. I think you have to separate the situation of what is being very actively considered now is getting a vaccine boost or an additional dose for those who are immune compromised. That's a bit different than the durability of response, whether you're a healthy elderly person or a healthy person who's not elderly. What will almost certainly happen over time is that we will need to give people ultimately an additional dose to get maximum protection.
And ABC has also seen internal CDC data that suggests more than 1 million people have gotten a third dose, a booster, even though boosters are not FDA authorized. Do you support people seeking boosters for now?
You know, what I support is people following the guidelines that will be coming out, be it for those who are immune compromised, as well as those who are now being followed in cohorts to be determined just what the appropriate time to give to a booster. So obviously, I'm not going to be recommending boosters based on things that are not the policy, both of the regulatory agency, FDA, and the ACIP, which is the Advisory Committee on Immunization Practices, which will recommend to the CDC about what the proper approach should be to boosters.
We spoke with a gentleman by the name of Travis Campbell 7 days ago from his hospital bed in Tennessee, and he had a sobering message for Americans who are still thinking about on the fence or hesitant about getting vaccinated. Let's take a listen.
If I have a day or two left, I don't want to waste my time. I want to help as many people as I can to let them see the real truth, that it's real, and it's only getting stronger and faster, and it's very important.
We are happy to report that a week later, Travis is out of the intensive ICU and expected to go home tomorrow. But why do you think that so many people are not heeding this message to get vaccinated until, in many scenarios, it's too late? And we see these pleas on their hospital beds to say, hey, I want to tell my family and friends, don't be like me. Go ahead and get the vaccine.
You know, as a physician who's been taking care of patients now for over 50 years, that scene is very painful for me to see, because I know it goes on so much. what has happened in this country, and you don't need me to tell you that, is that there has been such divisiveness, and ideology and false information has gotten mixed up in what's clearly a public health issue. It's crystal clear. The enemy is the virus. We have a very good countermeasure against the virus. It's a vaccine, and there are public health measures that mitigate in addition to the vaccine, like mask wearing. It is just incredible that in this country, where we have the resources to protect our people, that we're having ideological differences are preventing people from getting the intervention that will save their lives. So when I see something like the scene you just showed, it's just, as a physician, as a person, it's so painful to see that, because these types of things are entirely predictable and entirely preventable. So why don't we just put all of that other stuff aside and deal with what is a clear public health issue, not an ideologic issue?
And let's talk about children and COVID. If I can, for a moment, Dr. Fauci, I want to take my journalism hat off and talk to you as a mother. I have a 7-year-old son who's about to be returning to school in just a few weeks. Do you feel that the FDA should be moving faster in order to authorize a vaccine for children who are in that age range of 5 to 12, especially considering that pediatric ICUs are overwhelmed and school is starting? What's your advice for parents who are about to send their kids in that age range back to school?
Well, let me answer you first. You've asked two questions there. Let me try your first one. One of the problems of saying that the FDA should be acting more quickly is that if they act more quickly than what they feel is important to ensure the safety and the credibility of a vaccine, then their own credibility will be moved and modified and compromised, and we don't want that. They will come up with their regulatory approval at an appropriate time. I would like to see that as soon as possible, because you do want to protect the younger children who are not yet eligible for vaccines. To your second question, as a mother, we want to make sure that the kids who go to school are safe, but we want to make sure we get them back to school, because we know of the deleterious consequences of keeping children out of in-person learning. There are mental health issues, there are social developmental issues, and a variety of other issues. So we really want to get the children back to school.
At this point, do we have to rein ourselves in that herd immunity is not possible and we may be getting seasonal COVID shots for the foreseeable future?
Yeah. I don't think that's necessarily the case at all. I mean, herd immunity is a concept, and the concept is when you get enough people vaccinated together with people who have lasting immunity from having gotten infected, then what's going to happen is that the virus is going to essentially disappear, the same way it's done with measles when you get a number of people vaccinated, and polio when you get enough people vaccinated. That can occur. What the threshold is, what the level of vaccination or what have you is, we don't know that yet. We're dealing with a very difficult virus because it has the capability now, when it mutates, of being a variant. Fortunate for us, the vaccines that we have now do quite well against the variant, particularly in protecting you from serious disease. One of the things that people don't fully appreciate, that 93 million people in this country who are eligible for vaccination, who are not yet vaccinated, they give the virus a lot of leeway to circulate and ultimately perhaps be an even more difficult variant. There's a very clear tenet in virology that viruses will not mutate if you don't allow them to replicate. But when you give them free rein to be circulating in the community, you give them ample opportunity to mutate even more, which means it's conceivable that if we don't get control of that and don't get a lot more people vaccinated, that there will be a variant that will occur that might even negatively impact the vaccinated people, because it may elude the protection of the vaccine.
Dr. Anthony Fauci, once again, and as always, we thank you so much for your time and your insight.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.